Hi, my name is Dr. Wes, and today we're going to discuss agenesis of corpus callosum and neuronal linkage. But before going towards the discussion on this topic, it's very important to know the functioning of the corpus callosum. Corpus callosum is the largest bundle of white matter nerves. It connects the left hemisphere with the right hemisphere and allow both sides of the brain to communicate. That is the major function of corpus callosum. Um, The other important functions of the corpus callosum is the motor coordination, sensory integration, language processing, learning and memory, and problem solving. So these are the few of the functioning of the corpus callosum. Congenital absence or underdevelopment of the main interhemispheric white matter bridge. That is the image showing the two hemisphere and the bridging between these two, and that is the part where corpus callosum plays a major role. What is agenesis of corpus callosum? It's a congenital disease, you can say, in which the corpus callosum completely absent, partially absent, thin or malformed. That is due to the genetic mutation in the genes that we discuss in coming slides. Uh, it may be isolated or associated with brain genetic, metabolic, or syndromic abnormalities. That is a very important part. Some individuals are minimally affected, while others have seizures, developmental delay, or learning difficulties. ACC is not a degenerative disease, it's a developmental wiring disorder of the fetal brain. That is the normal role. Complete agenesis, total absence of callosal fibers, partial agenesis, part of corpus callosum is missing. Hypoplasia, corpus callosum is present but thin, and dysgenesis, abnormal shape or malformation. Functioning effect, cognitive information, bimanual coordination, language analysis, integration, higher order reasoning, seer susceptibility is there. Genetic information, few are the genes uh, in which the mutation took place in patients like DDC, L1CAM, ARX, NTN1, ROBO1, AMX2, SOXG, and ZIC2. These are the some of the important genes that are affected due to the mutation and causing malformation of the brain part like corpus callosum and results in dysregulation of brain functioning. That is the image showing different regions of the brain uh, and the neurotransmitters that are affected uh, by the by this disorder of the brain. Mechanism of disease, it's very important. Developmental sequence, cortical neurons, extended axons towards the brain, midline during the fetal development, abnormal longitudinal post bundle may form along the ventricular walls, result reduce interhemispheric communication and variable neurological outcomes. That is the disease mechanism flowchart, genetic environmental development factors, axon guidance, glial scaffold disruption, colossal axon fail to cross the midline, absent partial hypoplastic corpus callosum, reduced left right hemispheric communication, which result in developmental delay, seizures, learning, or coordination in problems solving. ACC is best understood as a congenital neural wiring disorder. Colossal axon fails to cross the midline, reducing the communication between cerebral hemisphere right and left. Clinical manifestations may have normal intelligence or subtle difficulties with processing speed, social cognition, complex problem solving, and coordination. Developmental features delay motor milestones, speech delay, learning difficulties, hypotonia, feeding difficulties in infancy, and adaptive skill changes. Neurological features seizures, poor coordination, vision, hearing problem, hydrocephalus, or associated structures of the brain abnormalities might be there. Symptoms including brain malformation, genetic syndrome, neuronal migration disorder, metabolic diseases, neuroplasticity may compensate for missing a colossal pathway, especially when ACC is isolated. A detailed developmental or neurological assessment is essential for individualized care. That is the clinical spectrum in ACC. Diagnosis. Diagnostic workup means the neurophysician have to go through certain points like MRI uh, and genetic testing like karyotyping, microarray, gene panel, or other tests should be there for these kind of patients. Developmental vision, hearing, seizures, assessment, guide management, treatment and support, individual care plan, neurophysician, psychiatrotherapy or psychotherapy or occupational therapy should be there, speech, language delay, so speech therapist should be helping the patients, learning difficulties, behavioral or social cognitive difficulties, psychological and behavioral interventions. Hydrocephalus or cyst neurosurgical evaluation, if clinically significant, should be there for the patient if the patient is in need of that. Prognosis, best prognosis, isolated ACC, no major seizures, normal or near normal development, and a strong early developmental support. Cardiac prognosis, associated malformation, genetic syndrome, hydrocephalus, neuronal migration abnormalities, or refractory seizures. Long-term follow-up should be there with the physician. Prognostic determined isolated versus syndromic ACC, presence and severity of seizures, degree of developmental delay and intellectual disability, associated brain malformation or hydrocephalus, access to early interventions, rehabilitation, and special education support. That is the practical message for these kind of patients and for the physicians. That is the summary. Should know the mechanism, diagnosis, what kind of tests should be there for the diagnostic purpose, treatment, supportive seizure control, therapy, education, behavioral care should be there for these kind of patients, and prognosis, highly variable but best when isolated and supported early. Thanks and regards. Please like and subscribe this channel for further discussion on different kind of diseases. Thank you so much. Take care.